understand we're facing an unprecedented threat to public health and to our society, and I think our first priority has to be to do everything we can to avert the tragedy and calamity that we see unfolding in Italy, which understandably is striking fear into the hearts of many in this country and across the world. And as others have done, I want to extend my condolences to everybody who's lost loved ones, whether it's in this country or in Italy or anywhere else in the world. And we have to do everything we can to minimise that tragedy and protect people against the threat of COVID-19. And the first thing that has to be done to do that is to support, equip and resource our health workers who are the front line, who are putting themselves on the line to protect our health. And as the European Centre for Disease Control clearly underlines, we have not done that. We don't have enough staff, we don't have enough beds, we don't have enough ICU capacity, we don't have enough personal protective equipment, we don't have enough lab testing capacity. So we need now, urgently, to provide those resources to support those health workers. And all those who in their droves are volunteering, the heroes who are now volunteering, to build up the capacity that we had failed to provide and the support and resources we had failed to provide for health workers and for health services in this country. And our particular plea, which we have put over the last few weeks, is given that we don't have that capacity, we have to financially and in every other way support the health workers who are coming into the health system, pay the student nurses, and immediately and without hesitation take into control private lab capacity, private industrial capacity that could be used to produce PPE, to get hold of any stockpiles of PPE so it can be provided to our health workers who are currently rationing it in the hospitals. That's the situation, and I would urge the government to do that. The companies that can produce ventilators, there should be no negotiations, no discussions. We need that productive capacity to produce that equipment. We need to support our essential workers and reward them. Retail workers, public transport workers, power workers, water workers, public servants who are putting themselves on the line need to be supported and resourced. And I hope we learn forever the importance of these people who have often been very undervalued and underpaid in our society. We need to support everybody, the millions of people who now, through their actions of staying at home and social distancing, are protecting our public health and protecting the ability of our health service to cope with the surges that are coming. We need to support them. And while I welcome the government's change of heart to increase the 203 payment to 350, we must remove all stresses, burdens, anxieties and worries from the shoulders of people who've lost job, lost income and who are at home and contributing to the public health effort. And I would say this to the Minister and to the Taoiseach: we need to press the pause button until we are through this emergency. On rents, on mortgages, on utility bills. We need an amnesty for the duration of this emergency so those pressures are not coming down on the shoulders of people who, through their actions, are contributing to protecting us all. And finally, Count Corla, we need to protect the vulnerable. We need to protect the homeless, people with disabilities, people living in overcrowded conditions. All the public health advice says these things are bad and weaken our ability to prevent the transmission of viruses like this. So we need any empty apartment blocks or hotels or spaces that could be used to ensure that people are not living in overcrowded conditions immediately requisitioned and made available to people so they are not living in those conditions. And many are asking, if the government have now recognised that 203 is not enough for workers who are laid off to live on, is it enough for our pensioners? Is it enough for those with disabilities? Is it enough for those who happen to lose their jobs 6 months or a year ago who are looking for work? And the answer is no. So I hope we will learn these lessons. Who's essential? Protecting our health services and protecting the vulnerable so that we, as a society, can come together to face the threat of COVID-19 and come through it with the least possible tragedy and calamity.
Thank you, Deputy